why are we calling blood pressure medicines first-line therapy or second-line therapy? Well, first-line medications, as I mentioned before, are usually ACE inhibitors or angiotensin receptor blockers, ARBs. And these are used almost always because of the fact that we want people to have kidney protection as well as heart protection. And we know these drugs do that. So why is it then that we have to have all these other different blood pressure pills around? Well, unfortunately, one blood pressure medicine usually is not enough to control blood pressure in people with diabetes. What is the average number of blood pressure pills that people with diabetes are on? 2 or 3. So it normally happens that it takes 2 to 3 blood pressure medicines to control your blood pressure. Now, if you're on one and it's controlling it great, congratulations to you. But most people with type 2 diabetes actually need 2 or 3 blood pressure medicines to actually control their blood pressure. It's important to understand that the problems that I see a lot have to do with the misdosing of these types of medications. So it's important to understand that many people like to put you on a very low dose. So what will happen is you'll come in, you'll have high blood pressure, and the doctor will start a very low dose of a medicine. Well, the most effective dose of most of these medicines is about half maximum dose. So it's very easy now on the internet to look up the maximum dose of these blood pressure pills and figure out in conjunction with that, what dose are you on? The maximal effective dose is usually about the half maximum dose. So take a look at your blood pressure pills and see what you're on. If you're on a very low dose of one blood pressure pill and your blood pressure is still uncontrolled, it may be worthwhile to either increase that blood pressure medicine or add a second or third line medication. Anything other than an ACE or an ARB is really called a secondary medication or a tertiary medication or third line blood pressure medicines for the treatment of high blood pressure. But what's most important is most clinicians will add as many blood pressure medicines as you need to get your blood pressure to the goal that we mentioned before, which is less than 130/80.